Education is honestly a topic for the ages. It's all encompassing. And so when we talk about education and the influence of it with regards to elderly and with medication, it's always a difficult piece to understand. But there are several layers within that. So the first thing I always reiterate is that we have to remember education as a whole is not the same as it was in the past. And so there are a lot more uses, and there are a lot more avenues that are available to you for study. So when you have your elderly patients and you have friends and family who may not have had the socioeconomic status or the education level that is currently available now, it plays a major part in understanding your drugs and prescriptions and physicians and the healthcare system in general. And so what this article essentially talks about is saying that to understand polypharmacy and to understand diseases and how disease works in your body, you have to be educated about that. And because sometimes there was maybe a lack of education because of understanding or availability or exposure reasons, you may not have that depth of knowledge. So what you want to do with that, and what the study will show you, is that they honestly go hand in hand. And in order to prevent that, in order to move forward and to better educate ourselves, is that we have to educate the older population and let them know that, hey, these things are all encompassing with your disease, and that we want to educate you better about, you know, how to progressively move forward. You may not have the exposure, but it's something that you can assure that you get to them. And so inappropriate drug use comes from not understanding what the directions are. Something that in pharmacy that is a common rule is that when you write a prescription, you make sure that everyone up until a 4th grade reading level can understand. Because you have those instances where people did not complete school to a level of what you would think is adequate, even high school, and you have parents who haven't completed high school and they don't quite understand what the directions are. And when the directions change frequently and oftenly to assess a disease and to lower the symptoms, it becomes confusing. And so all of that together brings about a notice or a need for everyone around to be aware that understanding is the key piece. Make sure communication, because that's a general concept, and you might not have the education level to understand what the medication will do chemically in the body, but you understand what you want when you take it. So if I take a Tylenol, I'm expecting it to relieve pain. I have an expectation of this medication. If I have heart disease, I want it to, my beta blockers and my calcium channel blockers, I want them to do what they're supposed to do. Now, I may not understand what those terms mean chemically and how to express that, but I have an expectation of what I need. And so if you give out the information for education and you provide that to your patients, it honestly helps. And so the study shows that their education is direct correlation to understanding. And so if you give the knowledge pieces, then you essentially decrease the risk for inappropriate drug use.